with the support of the patient and our nurses. Let me just tell you a little while. After finishing, we'll do a compression here, and after compression, the patient will be discharged in 2 days' time. I am Dr. Vivek Gupta from Apollo Hospital, New Delhi. We have done a quick procedure of automatic implantable cardiac defibrillator, which is AICD. And with our team of the technician, Mr. Shyam Sundar, we did early morning case. And he's one of the senior most technician in our Apollo Hospital. I'm Dr. Vivek Gupta, and one of the senior most nurse, Asharjeet, and a nursing assistant with this. The procedure of automatic implantable cardiac defibrillator, which is known as AICD, which now people know it, is one of the procedure, a device which is used as a policeman inside the body of the patient. It is actually for the purpose of prevention of sudden cardiac arrest, which can happen in any patient who has got less ejection fraction. That means the heart functions are compromised, either as a dilated cardiomyopathy or ischemic cardiomyopathy or post heart attack. These patients are more susceptible to develop arrhythmias, which can convert into sudden cardiac arrest, and therefore this device is very useful for prevention of sudden cardiac death and sudden cardiac arrest. I should tell the audience that this device is now, although being used for last 5 to 7 or 10 years, but is still not so well known among the patient and the family. The audience should know that, especially the patient family, that this is a very important device. When it is advised by the patient, by the doctor to the patient, it should be taken up as early as possible. One important deterrent factor in getting this device is the cost, because this is little more expensive than the normal pacemaker. This looks like a pacemaker, but it is actually not a pacemaker. But pacemaker facilities are also added on in some devices, which are, for example, a patient who requires a pacemaker also because of the disturbance of the rhythm, or because of the sinus node disease, or because of the low heart rate, or because of the AV blockages. Then of course there's a combination which is required wherever you have a VDD facility in a single chamber AICD. So we have done this procedure. The patient who had a recurrent VT, this patient had an MI about 21 days back, and then following that we did the revascularization. After 5 days, patient had cardiogenic shock, patient had acute LVF, patient recovered very well, but we had some episode of VT happening in the hospital which required cardioversion, and the patient was discharged thinking that this will not happen. Patient was put on antiarrhythmic drugs. But unfortunately, for whatever reasons, patient also had a VT at home, which was resuscitated by his very intelligent son, and the patient recovered and were brought back to the hospital. We did the echocardiography, which was showed that ejection fraction was 35 to 38%, which was existing like that. But considering that patient had a multiple episode of VT, almost leading to VF, and patient had seizures, we thought that this device is important for the prevention of sudden cardiac arrest in future. So this is a very important indication. I think, Shyam, you will agree that such patients should always be given such device, and this is there for the lifelong. And when this is like a policeman, does not work. It only keeps sensing. Whenever there is an episode of bad arrhythmia, it will pick up and start. We have to computerize it so that it will not do shock all the time. But whenever there is a bad arrhythmia which leads to sudden cardiac arrest, or which leads to VF, which leads to syncope, which leads to seizures, it will immediately shock, immediately inside the heart, automatically, without any. It can happen anytime at home. So this will be a policeman inside the home where the patient's life is secured, safety is there, and this will give shock and divert the patient bad arrhythmia into a normal sinus rhythm, and patient will be back to normal. Patient does not feel normally such shocks because this is a very small shock. It's only 15 joules as against 250 or 400 joules, 200 joules, which is required when you will due to external shock. So let me tell you that this device is important. AICD device, which we have just shown in this video, is a simple procedure like a pacemaker. Step by step, I showed you initially the local anesthesia, followed by puncture, which goes into subclavian vein. Then of course putting the sheath and the wire, and then the lead, and then of course fixing the lead with the device, then suturing and putting into the pacemaker pocket, and where then after pocket you have to do suture. The whole procedure, if remains uncomplicated, should not be more than 30 minutes to 45 minutes, which we have taken about 45 minutes procedure. The suturing takes some little more time, 10-15 minutes. It's a 45 minutes procedure. Sometimes you get more delayed because you don't find a good vein, you don't get puncture easily. So we were very lucky to get a puncture immediately in one shot. So thank you very much for watching this video.